Right, there are three main bones that we're going to go over. The first one is this guy. That is called the what?
Clavicle.
Right, the collarbone or the clavicle. Right. In terms of what you need to know with the clavicle, there are two distinct ends. The big fat end articulates with the sternum. So this is called the sternal end of the clavicle. The flattened end articulates with the scapula, specifically the acromion process of the scapula, so therefore it's the acromial end. All right? So clavicle, those are three things that you have to know. This then is the scapula. We start here with this big ridge that runs down the middle. That is the spine of the scapula. There is a depression below, and there is a depression above. The depression below is called the infraspinous fossa. The depression above is called the supraspinous fossa. Okay? If we follow the spine down, it does flatten. That is the acromion process. If we turn it, we can see that there's another process that sticks off the front. That is the coracoid process. And then we do have this flattened area, and that is called the glenoid cavity. All right? The glenoid cavity is where the humerus articulates, right, and forms the shoulder joint. Okay. You've heard of the GH joint, the glenohumeral, is the glenoid and the head of the humerus. The only other things on here that you have to know are the borders. This would be facing this way, right? Mm-hmm. So this then is closest to the axillary armpit, right, or the axillary region, so that's the axillary border of the scapula. This one then is closest to the spine, right, so it's the vertebral border. Can you tell me medial and lateral? Sure you can. All right. So lateral is axial, medial is vertebral. All right. So that's the scapula. The bone that I'm holding in my hand right now is the humerus, right? So this is the head of the humerus. Articulates again with the glenoid cavity. Now if we look at it, there are two big bumps on the head of the humerus. There's one, and there's one. The bigger bump is called the
lesser.
The bigger is called the
greater
tubercle. The smaller one is called the lesser tubercle. And then we have this little groove that runs between them. That is called the intertubercle groove. All right. We have this little ridge right out here that sticks out. That is for muscle attachment. The muscle that does this, which is which muscle?
Your deltoid.
That's deltoid, so this is the deltoid tuberosity. All right. If we now look at the distal end of the humerus, we have a flare here and a flare here. Both of those are epicondyles. This then, if it's on the same side of the head, is the medial epicondyle. If we're looking out here, this would then be the lateral epicondyle. And then we do have two bumps down here that articulate. If we're talking medial side, then this is the trochlea. If we're talking the lateral side, that is the capitulum. All right, so trochlea, capitulum, medial epicondyle, lateral epicondyle. We have two bones that make up the forearm, right? We have the ulna and the, the radius and the ulna. How do we know which is on which side?
The radius is
by the thumb side.
Right, so if you're looking again in our anatomical position, then the thumb is the ulna. No, thumb is the radius. I always try to go PU, right? Pinky and ulna. All right. So if we look at the radius, there's only a couple things on here. Obviously, you got to know the radius. If you look at the flattened spot up here, that is the head of the radius. All right. We look at this. This is another little tuberosity. That is where the radius attaches the muscle. So that's the radial tuberosity. And then if you look at the distal end, we have a little prominence that sticks off there. That is called the styloid process. All right. If we look at the ulna itself, now again, the flattened spot of the ulna is also called the head. Notice that the head of the ulna articulates with the wrist. The head of the radius articulates with the humerus. Right, so opposite ends. The two things on the radius, on the ulna that you have to know. I need to have one apart, but there is two bumps. So this part here, which is really your elbow, right, the little bump, that is called the olecranon process.
Is that basically your funny bone?
Yes, when you hit it.
Okay.
Right. It does, I don't know if you can see it from there or not when you look at it, but it does make a C, right? So the top part's the olecranon process. The bottom part is the coronoid process. Okay? So we have a coronoid process down there, and we have a coracoid process up on the scapula. All right? So, olecranon process, coracoid process, head of the ulna, and the ulna does have a little piece that sticks off as well, so that is called the styloid process as well. So we have a styloid process and we have a styloid process. Where was our other styloid process?
On the skull.
Right, remember, it was just medial to the mastoid, right? The wrist, there are bones that make up the wrist. We're just going to know the general name of them. They are the carpals, right? You guys heard of carpal tunnel, right? So the bones of the wrist are the carpal bones. The bones here that make up the palm of the hand,
Metacarpal.
those are the metacarpals, right? The bones that make up the fingers are called the phalanges. There are 3 of them, right? So they do have a name. The one closest is the proximal phalange, middle phalange, and then the distal phalange. We look at the thumb. How do we know it's a thumb? Because it only has 2, right? It has a proximal and a distal, right? It does not have a middle phalange. That's it.